Hello and welcome back to our channel. I'm Dr. B from Doc Be Well. On today's wellness talk, we'll be discussing diabetes. Now this is a huge subject, and I've decided to tackle it with a series of videos. This first video will be an overview. I'm a board-certified family physician, and I've taken care of thousands of patients with diabetes. It's actually a quite common condition that presents to the clinic. Sometimes there's a lot of confusion about what it is and how it's diagnosed and how it's treated. I'm hoping to shed some light on diabetes with today's talk. So sit back, relax, and enjoy. The following information is meant to be a resource but not medical advice. Opinions are my own, but based on over a decade with direct patient care. Please consult your primary care provider for any questions or concerns. So let's get right into it and talk about diabetes. Today we'll review what diabetes is, how many people are believed to be living with it, what are the symptoms, how you diagnose and monitor diabetes, and how telehealth can help to treat this chronic condition. Diabetes mellitus is a condition where you have trouble processing sugar in your body. Sugar, or glucose, is important to energy production in the body. We need it to function and do work. Sugar enters the cell with the help of insulin. When someone has diabetes, they have trouble getting the sugar into the cell because of lack of adequate insulin production, and also sometimes resistance to insulin at the cell. This can cause glucose to build up in the bloodstream, unable to get into the body's cells. There are two main categories of diabetes, type 1 and type 2. The vast majority of diabetes patients have type 2, where your body does not produce enough insulin and also is resistant at the cellular level. Type 1 is a condition where the body does not produce insulin at all, and these patients are dependent on injecting insulin every day. For the remainder of the talk, we'll be focusing on type 2 diabetes. In the United States, it's estimated that over 38 million people are living with diabetes. Over 8 million of them are undiagnosed. That's 1 in 5 of diabetic patients not knowing that they have it. The majority of folks who have type 2 diabetes are 65 years or older. While diabetes affects every nationality and ethnicity, it's more prevalent in those of American Indian, Alaskan Native, non-Hispanic Black, and Hispanic groups. Now get this, diabetes is the 8th leading cause of death in the United States, and it costs an estimated $412 billion every year to treat. Diabetes is the number 1 cause of kidney failure, lower limb amputations, and adult blindness in the United States. Over the last 20 years, the number of adults diagnosed with diabetes has more than doubled. Patients with diabetes may experience blurry vision, increased thirst, and increased need to urinate. They may feel tired and have unexplained weight loss. They may have increased hunger, pain or numbness in the extremities, dry skin, slowly healing injuries and wounds, and they may experience more infections than usual. The diagnostic criteria of diabetes is defined by the American Diabetes Association as follows. 1. A hemoglobin A1C of greater than or equal to 6.5%. This is a measure of your body's average blood sugar over the last 3 months. It should be checked using a certified and standardized testing lab. I recommend checking this twice before an initial diagnosis of diabetes. 2. A fasting blood sugar of greater than or equal to 126. A fast is usually defined as not having any calories to eat or drink for the last 8 hours. Now you can still drink water and still take other medications as directed by your provider. For diagnosis, I recommend getting a plasma glucose level rather than a finger stick glucose, and I often will check it twice before making the final diagnosis. We can also diagnose diabetes using a special test called the oral glucose tolerance test. This fasting patient drinks a specific amount of sugar, it's 75 grams, and then the blood is tested 2 hours later. If they have a blood glucose level of 200 or higher after this test, it may indicate diabetes. The final way to determine if someone has diabetes is with a random blood sugar of 200 or more in a patient who has the symptoms of diabetes. The U.S. Preventative Service Task Force recommends that all patients between the age of 35 and 70 who are overweight or obese be screened for diabetes, and clinicians should refer patients at risk to effective preventive interventions. Check out our other video where we discuss the iHealth blood glucose monitor. This device is used at our practice to help monitor patients' blood sugars remotely. Telemedicine offers a valuable solution for patients with diabetes, enhancing access to care, promoting self-management, and facilitating regular communication with healthcare providers to achieve better diabetes outcomes. Telemedicine allows patients to share their blood glucose readings, their insulin usage, and other vital health data with their healthcare providers through a secure digital platform. This remote monitoring helps healthcare providers track the patient's progress and make timely adjustments to their treatment plan. With telemedicine, patients can schedule virtual consultations with their healthcare providers from the comfort of their homes or workplaces. This eliminates the need for travel and reduces the time and effort involved in attending in-person appointments. Patients also benefit from not having to wait in a typical medical practice waiting room. This minimizes the risk of exposure to infectious disease. Telemedicine enables real-time communication between patients and healthcare providers, allowing for prompt responses to questions or concerns. This immediate feedback can help address diabetes-related issues and prevent potential complications. Telemedicine doctors can provide educational resources and self-management tips to patients, empowering them to take an active role in managing their diabetes effectively. This includes guidance on diet, exercise, medication adherence, and lifestyle modifications. Through telemedicine, healthcare providers can prescribe and adjust diabetes medications as needed. Patients can receive medication instructions and updates on their treatment plan without needing to visit the doctor's office in person. Telemedicine can reduce healthcare costs associated with travel and in-person appointments, making diabetes management more affordable for patients. DrB offers transparent pricing without the need to use health insurance. We utilize Quest Diagnostics for discount lab testing. It's important to note that while telemedicine offers many benefits for diabetes management, it is not a replacement for all in-person care, especially in cases requiring physical examination or procedures. A hybrid approach, combining telemedicine with periodic in-person visits, may provide the most comprehensive care for patients with diabetes. Here are a list of great resources that I referenced when making today's talk. Check them out if you'd like to learn more. I hope you found this information useful. Stay tuned for more talks about diabetes. You can subscribe to the channel and hit the notification bell to be informed when a new video is released. As always, from my home to yours, wellness is a journey, not a destination.